I am here today with my friend, rock star, mentor, hero of all things in mental health, the godmother, if you will, of there we go, Linda. You went from it could have been a Godfather reference, and we took you to the mother of mental health, who's been at the helm of this
For so long.
for quite some time, but that means that she has a lot of information. And today she's going to talk with us about understanding evidence-based practice and what to look for. So, Linda, to help our listeners, how do you know if seeking professional mental health support will be helpful to you?
I don't think it's any different than seeking physical health if you're having chest pains or you have a sore throat, right? You're not doing well. Your condition is affecting your daily activities and relationships, and you seek care. Again, there is never a guarantee when you go for health care, but it is all likelihood you should expect to improve.
So, what if you're not improving? Like, what should you do if you see a therapist and you don't think you're getting better?
I think you have to tell the therapist, and it's scary to do that. Often we see our therapist as an authority figure, right? The way we see,
Mm-hmm.
our internist or our cardiologist. But I think you have to say that I'm not doing better. We've been working together for 10 sessions, and I'm still extraordinarily depressed, having trouble getting out of bed. And, how do you think I'm doing? And how do you measure my improvement? I think that's a question you should be asking, because they should be with you measuring using an instrument the way my cardiologist does with taking my blood pressure.
Mm-hmm.
Is my depression getting better? What's the instrument that you're using to measure it? Let's look at it together. And I think at the same time, you also want to educate yourself. You want to be an educated consumer. So
Yeah.
listening to videos like this, doing reading, even Googling expectations, I think those are all helpful things.
Great tips. So it can be very confusing for consumers. I myself am a licensed marriage family therapist. I'm also a licensed professional clinical counselor, and you are a social worker. Right there, that's confusing. Can you
Yeah.
help us understand the different types of providers that exist?
Yeah. I usually group people in two groups. One are people who can also prescribe medication. And that is doctors. Psychiatrist is a doctor, and nurse practitioners. And there are psychiatric nurse practitioners. I got treatment for anxiety after I had cardiac surgery, and I saw a nurse practitioner. I found that very helpful. She could both prescribe, and she also was a therapist. Then you have the other cluster, which are psychologists that in many ways are the most highly trained. They have the longest training period. It's very intensive. There are less of them. They usually charge more. And then there are social workers, licensed family therapists, marriage and family counselors, licensed counselors. All of those I put in a bucket of non-prescribers, but they all should have a relationship with a prescriber. So should you also need medication, they make that connection for you.
Mm. What about licensed versus not licensed? Does it matter?
I think it does. I think you want to see someone who's licensed, which means that insurance companies also verify that they are a practitioner. You don't want someone who has no training behind them, or at least doesn't have the paperwork that shows they've been trained and licensed. It doesn't make it perfect, but it is a safeguard.
How do you know what's the right one for you, the right kind of provider?
So you don't know, as I said, one of the buckets is prescriber, non-prescriber, but I think one of the things that matters a lot is, do they have experience treating your disorder? Are they skilled in the evidence? And do you connect with them? Are they getting to know you and you feel comfortable? Because nothing else matters if you're not comfortable. Being comfortable is necessary. It's not sufficient, though. So they also need to be trained and skilled, but the bottom line is there has to be a relationship.
Linda, what about getting support from people who might either be going through or have gone through similar things, but they're not actually therapists or, licensed mental health providers?
So I get a lot of calls, as I'm sure you do, Marjorie, from friends, family, friends of family, right, who have a relative or they themselves or their child is struggling and they, want someone to talk to. And they may live any place in the country. If it's about a serious mental illness, I will tell them to get in touch with NAMI in their area. My experience is that families who've been through it know who's good, who's not, know what insurance is all about. They really are a great network for you. And so are other groups, DBSA, which is, another self-help group. They have chapters everywhere. There are, community workers who are trained in behavioral health. So I think they are very important parts of not only you're getting treatment, but also you're getting support. We all need support. And there are places you can get that. And I think you should.
What would be a good first step that someone could take if they are in true acute emotional distress or they're struggling with an addiction?
So we're very fortunate in 2022, what is called 988 went online. It's available throughout the country. It's intended for psychiatric crises, whether someone is suicidal, homicidal, just worried they will hurt somebody in the future or themselves, or is just unable to control and regulate their emotions, is really quite upset, maybe damaging property or threat of, seems delusional, because it doesn't only have to be the patient that calls 988, it can be a family member or a friend. You shouldn't be ashamed to do it. And if you're not in acute distress, they'll figure that out, but they'll also connect you to care. So 988, still 911 is another place you can call. And certainly you can go to your local emergency room in New York, where I'm from, which you can tell from my regional dialect. Almost every major hospital in New York across really the state has what's called a CPEP, which is a comprehensive psychiatric emergency room where they specialize in psychiatric emergencies. So I think there are a number of resources available to you when you're in acute distress.
Last question, and you are amazing. Thank you for all of this. If you are not in acute distress and you're looking for care, and I'm going to have a bias on this one,
You go
where
to
does
Psych Hub.
one go for
No,
care?
no,
And
no.
I was going to say psych hub.
Marjorie, I wouldn't be spending my time doing this if I didn't have the highest regard for you and for Psych Hub. So I just underscore that
Thank
is the
you.
place to go.
Thank you. I appreciate it. Psych hub is always a place where people can go and get connected to the right kind of
Yep.
care. Linda, thank you so much for spending time with us today and helping everybody become informed consumers as they go on this journey, because it's the hardest first step is realizing that you want to get help, but the next step can often be even more challenging, which is finding the help.
Yes. Yes. Thank you for doing this, Marjorie.